My name is Sylvie Aubin. I'm a psychologist, clinical researcher. I am at McGill University at the Cancer Siegel Center at the Jewish General Hospital in Montreal. I have a specialty in genitourinary oncology, meaning prostate, bladder, and testicular cancers, and my subspecialty is sexuality and couple relationship function after cancer.
What can patients do to manage side effects of prostate cancer if they decide to forego treatment or go on an expectant management protocol rather than having invasive treatment for early stage or even later stage disease?
One thing that you have to do absolutely is to be your own advocate and follow what's going on in terms of the treatments very closely. The worst case scenario is to be on a watchful waiting program and just basically not follow up with your doctors or follow up with the news about the latest releases and treatments, especially in screening methods. The PSA is a big controversy. It's important to follow that very closely. The other bit that is very important is to take care of your health, take care of yourself. It's one thing to be informed about medical information, but it's another to be more aware of how you can be in control of improving your health, such as, exercising and diet, having a good dietitian counsel you on nutrition. The other piece is, of course, to foster and nurture your relationships with your loved ones.
Do you work with clinicians in your practice to be able to talk to patients and partners about the possible side effects of treatment as part of the treatment decision process? How does that work?
Absolutely. More and more we are trying to aim at early as possible education of the ramifications of every treatment a patient is presented with. Very often my role as a psychologist is to help the patient and their spouse, of course, understand themselves better and what would be a better fit. A typical scenario would be a patient that is offered a treatment that he feels is a little bit of pressure from the physician, either the radiation oncologist or the urologist, and feels very confused because for him that other particular treatment fits better, but it conflicts with what he was suggested. So my role is to mediate between the two options, for example, and to focus back on what is important for you. A very big point is, what is your quality of life? What aspects of your quality of life? A quick example, if for you erectile function is very important, and it doesn't matter the age, I've seen it in all age range, you better consider a treatment option that will either preserve as 100% or as best as possible, and helping the patient weigh that against longevity, and also factoring in the partner because he or she may have a different opinion about that.
How and when do you counsel couples about the non-cardiovascular long-term side effects of hormone therapy, including specifically the cognitive and body image side effects?
There's a lot of misconceptualization, again, about hormonal therapy. Again, it's not only about the lack of sexual desire or the erectile function problems, but it's also about the whole ramification of hormonal therapy. This, unfortunately, this is a very specialized area in the prostate cancer field, and there's not too much written about these other side effects. So they should be told from the get-go. And again, they have to be told without a fatalistic perspective. For example, if you tell a guy you're going to get all of these side effects, first of all, it can be very discouraging. But if you tell him you can get all these side effects, but there are things that you can do about them, that's a very different message. Again, I'm coming back to the sexuality piece because it's my specialty. But a lot of men are told, "Oh, forget your sexuality. You won't have any sexual desire." which is true, but that's not the end of the story. I've helped many couples recover their intimacy and their sexuality, as opposed to just, okay, I don't have any more sexual desire, let's abandon sexuality. So a hopeful message, in addition to the side effects, is important, and as early on in the process as possible, yes.
Is there anything else important that you would care to comment on?
I'm coming back, I think, to your first question about, as a patient and a spouse or a partner, you have to be your own advocate. Your caregiver, your treating physician or your care team are important players, but you have to focus back on what is important for you. Longevity is one issue, but quality of life is something that you should really look at in what aspects of your quality of life. So get informed into what you can do to maintain your quality of life, and there's a lot of things that you can do to maintain it. So be your advocate and get the help, get the resources, get information. There's also some very good support groups and advocacy groups for patients and their spouse with prostate cancer. An example is us too, the Prostate Net, big conference today. Get informed, get support. That's also very important.